Hello. Hello, good afternoon, everybody. Hi. Can everybody hear me? No, not really. Okay. So, we'll start the program. The first thing I want to acknowledge, sorry, Joyce, it's not in the agenda, but I wanted to acknowledge the people who worked on this event with me. So, Gini Celestial, from Filipino-American Initiative. And then we have Jay Africa, who is our Filipino-American Director of County Mental Health in Marin. And then we have Leni from San Mateo County. And who else? Is Roderick here?
Not yet.
Not yet. What about Joyce? Is Joyce here?
Here.
Oh, Joyce. So I wanted to thank all. Did I miss anybody? Wala. Okay. All right. So we're going to start, and we're just going to basically open the program. And one of the most important things we need to do today is to introduce each other to ourselves, because this is a significant gathering of Filipino-American mental health professionals meeting our senator from the Philippines, Risa, who is very much an advocate of mental health and health services. So because there's a large number of us, if you could just say your name and why you're, not why you're here, but what organization are you with? That way we can get a sense of who are all together with us here. Let's start with Leni.
Hi, Leni San Juan, San Mateo County.
What department?
Public Health.
Hi, I'm Evelyn Rodriguez, and I teach at the University of San Francisco.
Oh, if you could also add if you're a nurse or a social worker or.
Leni San Juan, Public Health Nurse, San Mateo County.
Thank you. I'm Evelyn Rodriguez. I teach at the University of San Francisco in housing sociology, and I also teach for our Philippine Studies program.
Good afternoon, everyone. I'm Dr. Gini Celestial. I'm a psychologist in 45 minutes north of here in Vallejo, California, for Kaiser, and I am the chair of Filipino Mental Health Initiative, Solano County.
Hi everyone, my name is Jenna Request, and I'm with the San Francisco Department of Public Health. I'm the program director of the General Health and Staff, which is a surgery access program for transgender and gender-non-binary people seeking surgery access.
I am Joyce. I'm a social worker for the Filipino-American Counseling and Treatment Team. Thank you.
Hi everyone, I'm Greg Palomares, one of the Tagalog-speaking attorneys at
Hello, I'm James Herse. I'm with Para, concerned citizen.
Hello, I'm Joanna Reyes. I work for DEH in the business office. I'm also a licensed marriage and family therapist, and I have a private practice.
Jay Africa, Director of Behavioral Health in Marin County, psychologist, and also a certified addiction therapist.
Hi, I'm Milka Ramos. I was in the clinician for 22 years and I'm doing adult services. And I wrote information on the technical impact of Filipinos with schizophrenia.
Hello, my name is Catherine Madua. I'm a postdoctoral psychology resident in Kaiser Permanente in Vallejo. I'm also the co-chairperson of FMH Solano.
Hi, I'm John Dubos. I'm a clinical psychology doctoral student, and I technically work in some.
Good afternoon, everyone. My name is Rael Sarmiento. I'm a recent graduate of Michigan University in Public Health, and I currently intern at Kaiser Vallejo with Gini in her department, and I am the membership coordinator at the FMHI Solano.
Hi, I'm Dr. Maria Araceli de Guzman. I'm with the Philippine Medical Society of Northern California, and we we are involved with medical missions to the Philippines.
Hello, I'm Cynthia Bonta. I'm an auxiliary member of Philippine Medical Society of Northern California. I also organize youth leadership conferences for youth, and in the mid-90s, we saw a film called Living Sacrifices, and it had to do with a lot of teen suicides in San Diego.
Good afternoon. I'm Bernadette Roco, and we have a private practice here in 490 Post, and we help a lot of elderly, depressed patients, and Dr. Hontiveros being helping us for a lot of referral that there's no fee, and I also belong to the Philippine Medical Society. We do a lot of outreach to better health education and medical mission.
I'm Agnes Salikpala, the retired pediatrician, also active with the Philippine Medical Society of Northern California.
I'm Dr. Feli Lau. I'm still actively practicing.
Is it business as usual? Because for someone who lives with depression or anxiety, how are you doing can be one of the toughest questions to answer. In the many conversations I've had with people who battle mental health concerns, even mental illness, particularly depression, one thing rings out in common. There are no words that can really describe how it feels when it's happening. Some say it feels like a terrible weight you can't seem to get rid of. Others say that it feels like a monster, a black beast that dominates you. And still, yung iba, they say that it's a feeling of terrible sadness. And that at times, because the sadness is so painful, being alive is painful too. Ang nakakalungkot dito, mga kaibigan, it's not the lack of science, it's the lack of acceptance. And the feeling coming from those who struggle is that no one will really understand what they're going through. There are many terrible cases of neglect towards those who struggle with mental health issues back home, particularly in the provinces, where some families keep their loved ones isolated in rooms away from the rest of the community. In the most extreme cases we've heard, accounts of people being chained to bedposts or beds to prevent them from wandering. And I don't think that these things are done because of a lack of love. It could be part shame, part fear, or simply that families don't know what to do. Maybe because unlike a physical health concern or a physical illness that we can see, isolate, and actively manage, ang nakikita lang natin sa mental health are its effects. And sometimes we think that, oh, it's just a matter of getting tougher. Or that people with successful careers, like celebrities for instance, are immune to mental health concerns or mental illness because of success. They aren't. No one is. No one of us is. I'd like to share a few things so that they paint a better picture of the situation back home para sa inyo mga kababayan natin na nandito. According to 2015 figures from the Philippine Council for Health Research and Development, the Philippines has a ratio of 1 psychiatrist for every 250,000 people. Baka pati yung psychiatrist o yung mental health professional or service provider, pili niya masisiraan siya ng sa dami ng maaari kailangan ng kanyang tulong. And before the mental health law, our nation spent only 5% of the health budget on mental health. Data on suicide is difficult to obtain because these cases are often underreported. But data from the World Health Organization says that there were over 2,000 cases of suicide in the Philippines from the years 2000 to 2012, with the majority aged 15 to 29 years old. Anecdotally, Dr. Constantine Chua, Chief Resident of the Department of Psychiatry and Behavioral Medicine at the Philippine General Hospital, told Rappler in an interview last year that one young person would come into the emergency room every day because of a suicide attempt. On September 13, 2016, Hope Line was launched by the Department of Health. This is a national hotline open to anyone seeking help for mental health struggles. They received, on that first day alone, 3,479 phone calls. 605 of the callers admitted to being depressed, and 111 of the callers confessed to being suicidal. This is a struggle that the mental health law tries to tackle head-on. It was signed, as Edwin said, in June of last year and carries several very important provisions. First, it mandates that responsive and primary mental health services become a natural part of the city, municipal, and barangay levels. There will be a Philippine Council for Mental Health, which will create guidelines for mental health programs to be developed by every local government unit and academic institution. LGUs and the academy will coordinate with government agencies and the private sector for the implementation of programs. Second, community-based mental health care facilities will also be put up. Third, hospitals will also provide those psychiatric, psychosocial, and neurologic services at those regional, provincial, and tertiary level hospitals. Fourth, the law also mandates that age-appropriate mental health education be integrated into our curricula at all levels, and that employers develop, promote, and implement mental health policies in the workplace. And fifth and last, that continuing research will be undertaken to produce sound data and evidence so that our mental health programs are not only effective and safe, but also culturally relevant. The 5 points I shared with you are just some of the features of the law. And this law is anchored on a vision that recognizes mental health as something real, something urgent and vital to the future and successes of our families, our schools, and our nation. Kasi sa tingin ko po, we have built a world that's so fast, so overly stimulated, so produced and curated, that we can take our mental health for granted. At hindi ako magkukunwari. There would be difficulty slowing down. But there is hope. Mga minamahal ko mga kaibigan at kababayan. This law brings a message of hope that all of us who pass each other on the street or might share a casual meal at the table don't have to struggle alone. When life happens, we can pick up the phone, send a message, or visit a hospital or health center and ask for help. No judgment, no labels, just help. And in the generations to come, we'll really be able more to say that we are okay. Marami pong salamat sa mga kapatid.
I'd like to invite Jay up to the floor so Jay could issue a welcome to Risa from behalf of all the providers here. And he'll do a presentation to you, Risa.
I was just saying that if you ever need a staff, I'm here. So, thank you for that. So, I just prepared a short remark. I really wanted to be concise. I know that we want to have more of our colleagues share what they want. They have what we're doing. So, so on behalf of the many Filipino-American service providers who have made their homes here in the San Francisco Bay Area, Thank you again for being here. As you will learn and hear today, many of us have been involved, some for decades, in addressing the mental health and substance abuse needs of Filipino-Americans. Many of us have different roles, providers, advocates, administrators, etc., in both public and private settings. All of us, though, truly care and love doing this work. So in my role as the Director of Behavioral Health and Recovery Services in Marin County, which is the county north and here past the Golden Gate Bridge, I oversee the provision of mental health and substance abuse services to about 250,000 residents in Marin County. Much of my work is focused on administration, programmatic, and policy work, leading an organization with over 200 employees, serving the needs of mental health and substance abuse. My advocacy work, though, is focused on shifting policies and programs to understand and include the social-cultural context of many of our communities in how we prevent and intervene in health. What is it like to be a Filipino-American in a primarily white-centric society? I don't want to be controversial, but racism, homophobia, transphobia, ageism, classism is very strong in this country, in the Bay Area, even within our Filipino-American community. Right? Yes. And until we recognize that, this is only a small issue. It is really important to highlight a systematic and coordinated approach to address these issues. And it is really critical that the framework of culture, of the Filipino-American culture, is at the core of our work in this community. Many of us here demand that to appropriately serve the needs of our kababayan, our efforts to improve cultural responsiveness or cultural competence should be embedded in all systems of care, not just healthcare. For many of us in the field, the message we continue to elevate and advocate is simple. To serve our community effectively, you have to understand our culture, our beliefs, our history, and all the things that make up who we are. The systematic, culture-rooted perspective is at the heart of what we do. Am I correct?
Yes.
So there is both local and statewide work that is being done. Funding has been made available to support these efforts. Programs have been tailored to meet the unique needs of the community. But in my honest opinion, sweeping reform in healthcare that strengthens mental health and substance abuse parity with physical health is really what is needed.
Yeah.
Everything else is just a drop in the bucket. So many people talk about stigma. For me, stigma is a small piece. Until there are resources and laws that actually increase resources of providers, education, funding, this is all a drop in the bucket. So actually, you'll hear actually many of our colleagues talk about the work that we do, and you'll notice I have sort of stepped out of the provider role and really started really looking at it from a sort of a higher level ground. Although the work that many of my colleagues every day I think are equally important. So we really are very excited to share with you, and actually for folks who have not been brought together in a long time. Milfe and Jen was telling me earlier that, oh my, there's so many new people. And I think that's really very important. So we are thrilled actually to hear the work that you do, which is really progressive. And I actually I Googled you last night. To really know who you're all about. But I think more importantly for me is really thinking about how I can support you, how this community can support you. Because at the end of the day, this is really not about us, but for many of the residents and our kababayans that really need the help. We're sort of very lucky because we have jobs, we have the opportunity and the privilege to serve people, but there are still many people who are in the silence in their homes and for no help. So also many of us, we are very committed in this work, but there is a bigger system here that we are also trying to go against. So it's an honor to meet you. It's really great to see all my colleagues and have been inspired by the work of the folks that have come before me and given me the opportunity. But there are also, I'll just say, Senator Hontiveros, wonderful leaders here. Wonderful leaders. And I really am grateful for the opportunity to meet you. Thank you.
Okay, so we will start out the presentations to Risa. I just wanted to highlight about what Jay said, support. We do want to support Risa. I just want to reiterate again that Risa is a vocal opponent against the treatment of drug addicts in the Philippines. You all know what's going on there. And for that, he's earned the enmity of the current president of the Philippines, who has manufactured trumped up charges against her. So support for her means that as well. I just wanted to highlight that. So can the people who will be presenting please, we have an agenda, so who's first? Can somebody moderate that? Maybe Joyce, you can moderate.
Sure. So, Laarni, thank you for coming. Laarni is a nurse from Filipino-American Market.
Good afternoon, everybody. Madam Hontiveros, Senator Risa, and fellow community. My name is Marnie San Juan, and I've been a registered nurse for 26 years. I'm specifically a public health nurse, and I actually work in one of the fine counties here in the Bay Area, specifically San Mateo County. And so I have the honor of visiting families actually out in the community, where I actually see them in the home settings. Sometimes I go to their work, their school settings, homeless shelters, and often coffee shops or the mall, because a lot of the families are, sometimes afraid or embarrassed for me to visit them. And I'm one of many public health nurses who do this kind of work. I do see Filipino families. I actually cover the northern part of San Mateo County, which is Daly City, South San Francisco, which has many Filipinos geographically. And as you know, many of them are immigrants to the United States. For us public health nurses, we do work for the county system, which is the government system. And as you know, the government system assists clients and residents who are in most need and often have difficulty accessing the services. So I do see many immigrants that come here that are often separated, from their loved ones back home in the Philippines or even other parts of the United States. And for me as a nurse, I witnessed obvious signs of mental health challenges in addition to financial struggles, in addition to their social acclimation. And so, as you can imagine, my home visit, my primary visit is to visit the mom and the new baby. But as you can imagine, our visits don't just encompass that. I assess their well-being. But in my eyes and in my heart, I see they have obvious symptoms of depression, anxiety, and for some moms, difficulty bonding with well-being. So when I recommend mental health services to them, as you can imagine, there's often like this extra exertion on my part to actually push that conversation, because there's a lot of denial with that part of their health. Mental health is often an unexplored part of our well-being. It's often mute. And as I stand here, I don't have the statistics per se from our county as to what public health nurses do and which ones pursue the mental health services from a home visitation perspective. But in my experience, it tells me that, many need to sense their symptoms. And, there definitely needs a lot more outreach and specific work to do with the Filipino community, especially in these intimate places of the hospital setting, as well as the home setting and the environments and communities we live in. So I just want to say that, I stand here passionately in this work. Public health nursing is my passion, and I continue to practice this with all of you.
Thank you for your attention, Risa, and for all of you for being here as we continue this dialogue that we have a long way to go. And I gotta say, it's so wonderful. When I was a student more than 26 years ago, there's many here in the audience that I started this journey with when we were Filipino Mental Health Resource Group, PMHRD. So it's an honor to be again in the room with people that are committed to this work. Thank you.
Thank you, Marnie. Next up is three groups called three initiatives in the Bay Area. Marnie and I started. I started in the San Mateo Filipino Mental Health Initiative, and then in San Francisco Filipino Mental Health Initiative. So there's now one in Solano County too. So there's three of We'll start with Stephanie. Stephanie, then Ray, and then Jean. Ray?
Thank you, good afternoon. Thank you, it's an honor to have you here. My name is Stephanie Balan. I'm a mental health clinician with Star Vista, and I'm also one of the co-chairs of the Filipino Mental Health Initiative in San Mateo County, along with Christy. And our main focus is to, for our initiative, I just want to name that our sister chapter, we actually were one of, historically, what were we, like 13 years ago? Wow. Yeah.
Well, it started a little even before us, but
Oh, yeah.
the version of the FMHI started in San Mateo.
San Mateo.
Yeah, about 12 years ago.
So our main focus is to decrease mental health stigma and increase quality mental health services, access to it, and then also conduct outreach and education to our community on mental health. Right now, some recent developments based on the research, we've identified a strong correlation between cultural identity and wellness. And so given that we have a significantly concentrated population of Filipinos in northern San Mateo County, we've identified a need to respond to our community in a culturally relevant way. So currently, we are working towards co-creating a cultural arts and wellness center cafe for our Filipino community through a needs assessment survey, which we'll be proud of. Chris is actually helping to spearhead that. And yeah, so we envision it to be a cross-generational gathering space, which includes components such as youth-focused school to career programming, and leadership development. Our intention is to solicit feedback and input from our community to inform the program development of the center and really to honor the stakeholder buy-in process. To be fully transparent, historically we've operated in silos, so we want to be more conscious of how to work more collaboratively and strategic in our planning. So from a public health perspective, we are looking at social determinants of health in a more integrative approach, critically thinking how to reframe mental health to be a part of a more holistic system that involves not just clinical support, but looking at the hierarchy of needs and elevating our inherent indigenous methods of healing in community through the arts and ritual. Rooted in the cultural value of Kapwa, we're also leveraging existing systems that work. So partnering with folks who are already doing the work and doing it well. And this includes schools, community providers, and even local businesses. Like I said, we're co-creating with our community natural touch points to access wellness support and services through this needs assessment, which we hope to have done by end of July. We really want to know what folks want. And so far, the data is indicating that what we propose is aligned with their vision. So it's good news. But lastly, from a business standpoint, we are employing a social enterprise model that will help to diversify funding streams to be more sustainable versus a nonprofit that may rely mostly on applying for grants and other funding sources. So that's where we're at. Again, thank you for all the work that you're doing, and we look forward to working alongside all the folks here. And thank you for letting us share our work with you.
My name is Jr. and the program coordinator for Filipino Mental Initiative San Francisco, and very much like San Mateo, we're not as old as San Mateo. We actually started 5 years ago, and we were established in 2014, or 2012, 2014, through picking up the work that has happened back in the 70s or the 80s around the mental health task force in San Francisco. I don't know how many people were part of that. I don't want to age people out. But thank you for your, and it's pretty much like the continuation of that work. And it's our capacity is based consists of community members, mental health advocates, and professionals, and also consumers to promote and to create a more kind of to promote culturally or linguistically appropriate services for our Filipinos here in San Francisco. And we're doing that by taking on projects that are relevant to the community, like and talking to people, finding out where the pulse is at, very much like what's being done in San Mateo, and just trying to like streamline the work that we're doing as the Filipino Mental Health Initiative in the Bay Area and the state. I'm going to pass it back to Mike to learn. He can talk more about what we've been doing and with regards to like our campaigns and projects that are really touching on the mental health in the Filipino community.
Again, some of the more recent campaigns that we've done is Usap Tayo, and I think that is the furthest reach that we've had even outside of the United States, and the purpose of Usap Tayo is to just begin to destigmatize conversations around mental health. We hold space for community members, so right now we offer a free Filipino Healer series. So any Filipino practitioner, whether in indigenous healing practices or folks that are practicing other modalities of healing, we hold space for them here and provide that for free for community members. Some things that we're doing outside of Bayanihan is we're working closely with the school district. So a lot of many of the folks in our core are social workers who work very hard and on top of their current workload are really trying to address the high suicide rates amongst our middle school youth and SFUSD. Did I cover all the things that we've done so far? Yeah, we're working on a lot of stuff. Just follow us on social media. FMHI,
Yeah, my heart's beating really fast, and I think it's tears of joy and also tears of pain. I think there's a collective grief that we all carry for our people, not only here but throughout the diaspora, the global diaspora. I just wanted to name that because it's real. I'm struck by your policies that you are pushing forward that are not only progressive but revolutionary. Putting not only your livelihood but your life at stake on behalf of the thousands of people who are suffering or lose their life because of, stigmatization. It's an honor to share space with you, Senator Hontiveros. Get it together, right? We share a vision for holistic health, and I was thinking about the work that we do in Vallejo, California, in Solano County, and where there's about 54,000 Filipino residents. But thinking of the 80 plus million Filipinos, if not 90 now, what is the population now?
100 million. 104 million. Last time I've been there, it's like 12 years ago. It's, you know, a little lower than that. But anyway, I'm sorry. I'm Dr. Jeannie Salesho. I'm a psychologist at Kaiser Medical Center, and I'll have my colleagues introduce themselves.
Hello, my name is Dr. Catherine Madeline. I'm a postdoctoral psychology resident at Kaiser. I work with Jeannie. I'm also the co-chair of FMHI in Solano. I also wrote a doctoral dissertation on the coping styles of Filipino-American caregivers of children with special needs.
So we represent Filipino Mental Health Initiative in Northern California, and we have used the term Philippine X. I'm not sure if it's being used in the Philippines, but it's used to be an inclusive term of Filipino, Filipina, and Philippine X people of Philippine ancestry. As I said, we have about 44,000 Filipino residents. It's about 12% of the population in the county. But of the mental health consumers, only 3% of the consumers are Filipino, meaning that it just shows the underutilization of services. There was a study by University of California, Davis Center for Reducing Health Disparities. I'm happy to share the report with you. Filipino participants identified depression, threats of suicide, problem gambling, and prescription drug abuse as their significant concerns. And in the work we do, we see a lot of suicidal teenagers. And so Kat's going to share more about that with you.
Yes, so Filipinos in our area in Solano County reported the following barriers to mental health treatment. So there's the shame and stigma when it comes to mental health treatment in our community, and there is a lack of linguistically competent or Filipino therapists in Solano County, as well as transportation difficulties. A lot of Philippine X members in our community have difficulties finding transportation just to get to their medical appointments, as well as there is also a lack of affordable housing in Solano County. As far as youth in Solano County, we found that a lot of youth have higher rates of depression and anxiety and suicidal thoughts than non-Filipino youth. And so FMHI Solano, we all hope to address these issues. And Jeannie will talk about our vision and mission statement. Thank you.
Our mission is very similar to our sister organizations, if not the same, to empower the Filipinx community through early intervention and education. And our vision is to increase access to resources that are culturally responsive and meet the intergenerational needs of the Filipinx community. We had our launch party in May with about 200 participants ranging from youth, middle school to our eldest was like 93 years old, performing a dance for us, a line dance, in her elder years, and it was so inspiring. And we're trying to incorporate modalities that speak to the different generations, Zumba, dance, performances, etc. And so we are co-laboring with you on this side of the world. And to add to what Verma and Ray were talking about, we are using social media as a connecting point throughout the global diaspora of Filipinos with the Usap Tayo videos where people share about their personal experience with mental health. It's all the videos accessible on YouTube. That is through San Francisco Mental Health Initiative. And then we are also going to do a month long of that in October of this year. And so to keep the global discussion going. Facebook is also a great way to reach out to folks. So thank you so much. Oh, I wanted to say the stole. We wear that proudly at our graduations here to symbolize the people that we bring with us through our educational journey. And so we're glad to pass that on to you and you can bring it back home.
So the next speaker is the next speaker is somebody who coordinates and collaborates with other health workers in San Francisco so that we can have our resources. We will know resources and help with it. Lolita Quintanar is the person who does this organizing and collaborative work. Lolita.
Magandang hapon po sa inyo lahat and welcome again. And actually, I've been a social worker for 50 plus years, so guess how old I am? 75. and this is social work in the Philippines with the Philippine Mental Health Association. And I work also with Philippine Senior Center of Physical Community Services for many years, working with homeless population. And in support of the speakers who are very much concerned about mental health and the health of our community, Filipino community, I set up with a group of service providers in San Francisco, what we call the Tagalog-speaking Social Service Providers Network. That is the TSSP network. TSSP network. TSSP network evolved about 5 months ago because of the need to effectively serve the Filipino client population, in particular, as well as the general client population that we serve across ethnicities. We meet every last Friday of the month from 3 to 4 p.m. in various locations in San Francisco. The SSP network is a multi-sectoral interdisciplinary group. We do collaborative intervention and advocacy work to effectively serve our client community. The members are mostly for and with social service agencies and organizations in the city and county of San Francisco. This includes the Department of Public Health, the Adult Protective Services, Department of Aging Adult Services, the Filipino-American Counseling and Treatment Team of the South of Market Mental Health Center, and nonprofits like Cannon Senior Center, Asian Pacific Legal Outreach or APILO, South of Market Community Action Network or SOMCAN, HICAP, which is the Health Insurance Counseling and Advocacy Program of Self-Help for the Elderly, Curry Senior Center, and the Filipino Community Development Corporation. These are the regular members so far, but you're most welcome to join us. ESSP Network is not funded in any way by any entity, public or private. Membership is voluntary. However, some of our members' participation in the network is allowed by their respective organizations and agencies as part of their community outreach program. Members collaborate with each other in order to be informed of various issues and resources in the community. The multidisciplinary nature of TSSP network also allows each member to share their expertise, particularly in the health, mental health, and social service arena, while at the same time providing professional support to each other. TSSP network strives to work for a more appropriate, more responsive services, which are culturally sensitive to the needs of our Filipino community and the community as a whole. We speak several languages. I myself speak Ilocano, then we have Waray, Cebuano, Visayan, Ilonggo, Kapampangan, and would you believe we have one who can speak Korean and Hokkien. Right now, you've met some of them already who are here, but I would like to let them stand up again so you recognize them so that you can get in touch with them and maybe work out something together. Okay, we have Dr. Milde Ramos, a protective service worker who works with adults. We have Roderick Silva, a marriage and family therapist, and when he's not able to attend the meetings, he sends Kenneth. Kenneth. And then we have Kitty Torres, conservator of the San Francisco Public Guardian, and worked as a program officer with the Development Academy of the Philippines before coming to the United States. And then we have Jeremy Reyes, is a licensed psychotherapist, has private practice, and works part-time. Then we have Jerito Aquino, is the outreach coordinator of HICAP. Aquino is the program, self-help for the elderly, and she is the one who speaks Korean, because she worked there for 10 years and she set up the Philippine Women's Immigrant Community in Korea. I don't think Eugene Lim is here right now. He's a case manager from Canton Senior Center and has a medical degree from the Philippines and former manager of the suicide prevention work hotline of the Institute on Aging. And then we have Betty Duran, who is with the Tenderloin Neighborhood Development Corporation and formerly Regional Director of the Department of Science and Technology, Region 8, Leyte and Samar in the Philippines. Then we have Greg Palomares, a staff attorney. We also have, let's see what else, Lane Pavis, Filipino staff at Torrey Senior Center, who just organized the Samahang Pinoy. And we have Lucy Barbonio, who's not here today. She's a case manager for Somcan. Is she here? Somcan and Filipino Center. We have Josephine Umali, social services specialist at Catholic Senior Center. And lastly, we have Teresa Tan, social worker and at present program manager at Catholic Senior Center of the Physical Community Services. She was formerly a social worker for 12 years at the National Mental Hospital, which is now called the National Center for Mental Health in the Philippines, and married to Dr. Carlos Tan, formerly a psychiatrist also at the National Center for Mental Health for 20 years. And they're here now. And they also work with the Philippine Mental Health Association like I did. And thank you very much for giving us the opportunity to learn more about what we have here, and we hope that we can work together. And San Mateo, San Solano, and San Francisco, let's come together. You're most welcome. Our next meeting.
Alameda County.
Alameda County, okay. I work with you. Alameda County. Yes, and we are inviting you. We have our next meeting on June 28th at the Filipino Cultural Center. Have you been there? Okay, come and join us, and it's only an hour, chika, but then finish a lot of things. And if you'd like to do a presentation, you're most welcome to join us so that we'll know more about you and we can work together. Sorry, I've known her also for several years. Okay, thank you so much.
Maraming salamat, Malika. All right. Stay away from the speaker. All right. So our next speaker is director for the Filipino-American Counseling Treatment Team in San Francisco. So Roderick will explain more about the services at the clinic.
Senator, good afternoon. Welcome to San Francisco. We really appreciate what you do for our fellow Filipinos. And we can just hope that what we share with you today will give some kind of seed of ideas, vision, direction, and know that you're not alone in what you're trying to do, and you have us here to support. You know, let me just put a context to what the Filipino-American Counseling and Treatment Team is. It's a team that was it's an outcome born of a vision that started back in 1992 when our community leaders here in San Francisco came together and said we can't put up with all of these mental health issues and we're not addressing these things, and the county is not dealing with these things. There was a significant amount of
domestic violence, gang violence, depression, suicide that was happening. So our community leaders did a focus group from various sectors, different agencies to advocate for funding. And the founding, and a lot of the leaders that started this are actually here in this room, and I just want to call them out, not to embarrass them, but just, and also not to give out their age, correct? But I do want to say this was 1992. Okay, so I just want to recognize Edwin as one of the founders of Dr. Leope Ramos, Lolita Pantanaro is one of the community leaders that's there. Bernadette is one of the community leaders. And if I forget, please forgive me, but I know it's the beauty of the fact and how it came about was a product of unity, mutual understanding with mutual goals. The Filipino-American Counseling and Treatment Team, we have about almost a complete staff. We have our own nurse practitioner that manages the medication. We have 2 psychotherapists, myself and Joyce. We have 2 health workers now, Charles and Kenneth. We have Maria Watson. She does the primary care. She does a lot of linkage between mental health and primary care services. We have Vilma Posadas, who does a lot of our administrative support, checking on all our medical status and billing. And we have Heather Zahiri, who is not here, but she does the medication services as well. We have other staff who have also put in a lot of foundation to what the PAC does. So PAC, I'll mention somebody's name later. What we do is we provide individual psychotherapy, of course, using our language, based on our culture, and like Dr. Kiapika talked about the cultural perspective, root. We use a lot of that. We use a lot of family dynamics, so we get a lot of collateral support. As you know, a lot of our Filipino mental health clients oftentimes don't have the language to tell us what's going on at home. So the family becomes the voice, and often they provide us a lot of the collateral information that oftentimes is not talked about in the session. We also have groups that we run on a weekly basis. We now have 2 groups on a Tuesday from 1 to 3. We have the Zen Tango that is being led by Joyce in partnership with, I believe, with Kenneth. And on Thursdays, we do have the Filipino Cultural Awareness Group. The focus is wellness and recovery. What that means is we're tackling all aspects of their symptom management, coping skills, substance abuse, and any other issues that come forth. We talk about trending, where a lot of our Filipino clients are affected by what's happening in the Philippines and also here. So what we do is when there are news or calamities or whatever it is that's happening in the Philippines, we bring it into our group session so that our clients will have a space where they can talk about this and discuss how it makes them feel and how it contributes to their stress, to their symptoms. And the beauty of that is oftentimes in Filipino families, I don't want to generalize, but a lot of our clients tell us about this, that in their family, they don't have a voice. They don't have a platform where they can talk about their thoughts, their feelings, and their reaction to what's happening around them. So in the group setting, they're able to express these things. So when they go home, they feel like they can contribute to the discussion. One of the biggest some of the insights we receive from our clients is that because of the group, a lot of the psychosocial that we do, a lot of the psycho education that we do, they are having to find words in their language, Tagalog, whatever that is, that they can bring back home so that they can explain to their loved ones what it is that they're feeling. So for example, we were trying to figure out, how do you explain depression to your family? What is depression? How do you explain psychosis? How do you explain your hearing voices? How do you explain schizophrenia? So within the group, we try to come up with these terms, and they're able to then express what they're dealing with to their family. And also when they meet with their providers, particularly their doctors, they're able to express clearly what they're dealing with and their struggles. Our clients this week, we asked them, how did fact impact you? What did you get out of fact? Because we wanted to give you something, Senator, that you can take home with you, something that will stick. And some of just the statement they made is that they said, fact will help because it nagbibigay alalay, gabay, hindi mahirap humingi ng gamot, which is very hard for clients to ask for medication, for the right medication. Even one says that naligtas po yung isip ko. You know, natulungan yung brain ko. Na-heal yung brain ko. This person was dealing with psychosis. They're dealing with voices. So that's what we do. We see about average of maybe 150 clients per year. It's a 10% of our clinic population. Let's see what else. And we partner with a lot of community providers so that we can generate a lot of the referrals. In the initial stage of our program, because of the high level of stigma, we were using a lot of primary care services to bring the clients in. So we would have our nurse, former nurse, Rose planted at one of the Southern Market Health clinics so that any Filipino that comes through that way can be bridged to our services. We also have what we call a pre-vocational training program. It is one way for us to test to see if our clients are ready for the job market. And oftentimes when we refer to the bulk rehab services, if they're not tested, then they fail, and that just brings us back to a lot of the sense of loss, it reinforces the idea that you have mental illness, you're not supposed to work. So we have within our program clients that would come in and they help us prepare our group. They do the setup. They also do a lot of the sometimes cooking, of course supervised. They do the cleanup. We've come to a point also that we allow our clients to do the check-ins in the group where they, facilitate the check-in as well. We have clients that will bring in the current issue, what we call trending. So instead of generating from the staff, it is a client that brings that into the discussion and we process that. Why is that important? That's important because it really shows other clients that if he or she can do it, I can do it. If he or she, despite of the voices of depression, can participate and help out in the group, we can do it. So that when we approach them and ask them, it's not very hard to get them to say yes. So that's just basically what we do. There are other things that I can talk about, but I just wanted to give you a picture of how powerful it is when you have a mental health treatment services that is focused and rooted in culture, in beliefs, and you have the language capacity where they can speak from their own hearts, from their own minds, so they can feel understood and they can connect. Thank you for this time.
Salamat, Roderick, and the other people who have spoken, and wish that everybody could. I would like to briefly tell you, and maybe this is a good segue, because we wonder, Senator Risa, Honorable, and Kumarin Risa. Just kidding. So, but we were wondering how we can bridge and collaborate, because our community here would love to be able to, see what we can do to help out. We think about our people, we think about our country, we think about what's going on. And so, sino marunong Ilocano dito, when I heard about the mental health, parang napuulag din ako in joy, I was just really excited about the idea. Even yung concept pa lang niya, then it kept, getting pushed, right? Before it was signed, the Convention of Rights for People with Disabilities. The Philippines has signed, but for the longest time, walang ngipin yun kasi it was not ratified. So there's no accountability from the UN, human rights, to be able to implement yung accountability because walang law walang law ang Philippines. And so when I saw that there is, and then nung signing na, it was so exciting. Finally, we can have something, the people who can have something to show, look, we need this. So we are so grateful for your effort, and I know it's not easy. Matagal na yun in coming. And so to bridge that, and one of the things that I would like to present is a community-based mental health education program that I will be teaching in September sa Philippines, and hopefully I'll be able to see you when I go there. So it's called TAG, Tulong, Alalay at Gabay. In English, it's Triage, Assist, Guide. So this curriculum is actually, nagpapasalamat ako because our community here has helped me to be able to adapt write this curriculum that's more culturally based and easy for our Filipinos to understand. Starting from Filipino Mental Health Initiative in San Mateo, and the opportunity that, San Mateo Department of Health, when they taught me mental health first aid, and then, wellness and management recovery, Kamalayan, these are, and then crisis intervention and psychological first aid, all of those, written and evidence-based to teach. I will show it's Tulong, Alalay at Gabay, or TAG, is a program, it's a grassroots approach in educating civil society to identify warning signs and symptoms of the most common mental health problems, so that the lay people, are able to assist in connecting them to professional help. In addition, the course also trains community members to intervene, early intervention and crisis intervention. So, the words Tulong, Alalay, and Gabay are particularly picked because walang stigma. Right? It's not a psychological first aid, mental health first aid. People will like, right? Yes. And so, but the words Tulong, Alalay, at Gabay are words they will understand that yes, we're helping somebody, but it's not stigmatized. And so it's pretty simple. When somebody's suspecting, that the person would be needing help, do I help? Do I assist? Do I guide? And then that's when they know which, what help they can give to the person. And so, we have been in coordination with the Department of Health. Senator, I think you probably know Ms. Resi Cuevas, who is working hard to help this project to be implemented in the Philippines. So there's some trainings in September, and we hope that we can be there also to introduce it. They have been asking for this, and so it was so funny that when we were at the Secretary's office, Senator Duterte, some media called and said, "What are you doing for the mental health? What is the DOH doing?" And we were saying, we were just there to present this idea. So I'm really looking forward to it. So maraming salamat po to those who are here. I think you want to say something.
Meron pa ba magsasalita?
Wala na po.
Siguro, let's allow Senator Risa to have some reactions, feedback, and then we can open it up for a few questions. Go ahead.
Where will be the venue, and how can people get access to it, or who will be the audience?
I see. Ang audience niya is handpicked by the Department of Health sa Philippines. And so it's going to be from different sectors like Department of Labor and Employment, PMA, PNP, They will be the one to assign kung saan yung venue, but it's going to be during the first week of September.
So is it going to be just one venue, or is it going to be community-based venues in different parts of the building?
Oh, I see. No, this is more like training ng mga trainers.
I'm Ann Aldenbaugh. I'm a private practitioner, and I represent Contra Costa County. Just like way over there, I never said anything about it. There are also quite a few Filipinos there of a different sort. I think mostly my sort, like retired, worked hard in San Francisco, and then decided we were going to farm when they get older. So I have two things. One is the question, and this is always a good one. What do you need? And by when? And in what form? Evidence-based. That's my first question. And if you can answer that, but first let me make a comment. There's an unrepresented group of Filipino-Americans, I believe, who are dual citizens. The true Filipinos who are so torn, and it's not a mental illness. You are so divergent. You're one minute you're American, next minute, nako, Pilipino pala ako, nawawala ako, turo ng turo yung ilong, you know. So there are a lot of us now who are that. And I think that there's a dichotomy, and I also wanted to respond to this, right? Kasi, America is not a friendly country. It has become less and less as a result of the geopolitics that we now have to deal with. The Philippines is not either, considering the counterpart of our president. But the fact is, when you go to each of our separate, somebody said silos, I like that word. It is our immediate circle of support that matter. When you're here, you know, whether it's Alameda County, Vallejo, Fairfield, San Francisco, Soma, whatever, Daly City, it's your silo. That is the circle of support. Same thing in the Philippines. So my question is, and there's maybe no quick answer. How do we work together and collaborate, given that there are 92 different Filipino dialects? What's the last count? 7,158 islands.
They say depending on if it's high tide or low.
Exactly. Very, very divergent group of people we are. So my question is, how do we work together, given that, number one, we don't really get along that well among ourselves. Number two, we are so misunderstood. I think that, yeah, so those are the two questions. Okay? Just in terms of a background, I was clinical faculty at Leni Robredo, again, the only Filipino. I now am I'm like so ancient, Edwin, you know, I feel like I'm Edwin's grandmother. But I think also, well, no, but we're coming to everybody, right? I mean, let's not start from scratch, because we don't start from scratch. We have a lot to build on as it is. There's solid rock Filipino-American activism. Use us. It's there. And we're free. Okay?
Senator, gusto ko lang pong idagdag dun sa sinabi ng mga mental health professionals from Vallejo. Kasi kapitbahay namin kapwa county namin. Historically, ang entry point, maraming Pilipino sa Daly City, which is in the West Bay. Ngayon, dumami ang Pilipino sa Vallejo, Contra Costa, because of the US bases, yung Mare Island. Kaya maraming concentration ng mga Pilipino doon. So that is how important that area is. Tapos lalo na ngayon, dahil masyadong mahirap makakuha ng ng bahay dito sa area, karamihan sa amin, lumalabas para makabili ng bahay, which is about 35-40 miles away from the city. Pero doon kami nagtatrabaho. Dito kami nagtatrabaho. So, yun lang ang gusto kong, yung geographical location is also very important. Ngayon, may mga Pilipino din sa San Jose, which is in the South Bay. At ito naman yung mga Teki at saka mga IT. So South Bay, West Bay, itong area na to, tapos yung Contra Costa, East Bay, which is Fremont, City, Concord. So yun yung mga concentration ng Pilipino. Siguro next time meron tayong geography lesson.
So, with that, we think of what Sina Augusto Villalon used to write about, and other urban planners write about pride of place. And so I weave it into all the many rich points I heard from you today and took notes about it. This is for me also, and Jay, my head of policy, who's here, and Jay, at any point, please jump in also. This is how we work in my office, very collaboratively. This is such a rich exchange gift. Grabe. Even to go back to your two questions about what do you need and when, I love the questions. Thank you. Because it gives us what is to be done after this afternoon. And how do we work together and collaborate? Just to begin understanding and trying to answer those questions, I actually just go back one step to what you were saying about the TAG trainers training in the first week of September in the Philippines. And since it's going to be a trainers training with different government agencies, maybe, although it's already 3 months from now, but in whatever short period of time, we could explore even a modest but substantive and quality initial partnership. Maybe you'd like to explore doing, if your days there will be full, but doing even one parallel activity with the civil society advocates who work more than a decade and a half. Sabi ni Lolita, they started working on this in the 60s, but the advocates groups who worked more than a decade and a half, filing and refiling the mental health bill and never giving up until finally we were able to pass it, including a wonderful network called the Youth for Mental Health Coalition, which reminds me of, oh my God, I'm gonna get lost in all of the points you shared, which reminds me of what's, where is that? The points I think it was Sina Stephanie who shared, yes, about work, and Reynaldo about working with the school districts, addressing high suicide rates among middle school students, holding, one of Reynaldo's colleagues, I was able to note down here, holding spaces for healing, intergenerational, using the social media, the Usap Tayo, which is on YouTube, and which you're going to do. So there's the September, and then the one in October where you do a month-long Usap Tayo online campaign in October, also on Facebook. These are moments, this is the when, where what we need is to be able to begin working with you. And really, we're not starting from scratch. It's wonderful that your long and rich history of working on mental health here is going to meet a newborn, which is our Philippine mental health law in the Philippines, worked on for part of the 60 years, Lolita, but just given birth after 1.5 decades of legislative work, this leg. So it's going to be an intergenerational dialogue between your decades of work here and what we're just going to be beginning back home implementing a new law. So, Youth for Mental Health Coalition, they worked so hard with the psychiatrists and the other doctors and mental health and general health service providers by organizing symposia on campuses. Midway through the lobby process, we started adapting the fora to request that we not just have a one-off forum, then we weren't sure what comes next, because if nobody would ask, what do you need and when, how do we work together and collaborate, we would ask for, before or after the forum, a sit-down meeting with the organizations who were interested, student organizations, faculty, administration, non-teaching personnel, parents, if they were interested, to talk about mental health protocols for that particular school, even suicide prevention protocols for that particular school. And then in my office, we're at the very early stage of talking with the Department of Education, which I'm sure will be invited by the Department of Health and Training, talking with them and about if we can, with them, come up with those protocols, mental health, suicide prevention, then they could offer them to the public school system-wide. Public schools where sometime last year, reports were coming out about teachers also, especially young teachers, going through their mental health struggles, and some of them dying of suicide. And then the mental health law has a shout out to schools and workplaces. So aside from working with student and other school-based organizations, including guidance counselors, of which, like psychiatrists, there's also too few in terms of a healthy ratio with the student population. On the private sector side, so this is the other thing, aside from a parallel activity with civil society, maybe if you have the time during your visit in September, you might also consider one with the private sector, because we touched base during the lobbying process with human resource department heads who are struggling with their own stigmatization and discrimination about applicants or already members of their companies with mental health concerns. And the HR head saying, I worry. I mean, should I accept this person eminently qualified for the position? Should we keep this person who's so high functioning but admits, as if it were a crime or a sin, admits that they are trying to manage mental health conditions? And these HR department heads said, we also have to break our own stigmatization and discrimination, and in fact, be advocates for persons with mental health concerns continuing to have access to education, lifelong learning, access to work, and remaining members of the community, equal members of the community. Oh gosh, so many things I noted down. This was really stunning from Stephanie about the strong correlation between cultural identity and mental health. It should be self-evident and not something to stun a listener at a conversation like this. But yeah, lalo na if we, even when we're home and if we are abroad and in a new home, it's common sense that our sense of who we are as a member of a people with our history, our cultures, our languages should be a root of our mental health. And it reminded me of what Sina Father Bulatao wrote decades ago about Psikolohiya Filipino and how it's a root of our sense of well-being and our spirituality. And I have an initial sense from all your rich sharings that your experiences here in the United States and working with Fil-Ams would have a lot to further enrich and even update that. This wonderful elevating indigenous methods of healing. The mental health law talks about a full spectrum of paths to healing. So not just medicine-based or chemical-based, but others as well. One of the youth and student organizations that worked so hard also on the mental health law was this community of young people with mental health concerns who gravitate around a wonderful restaurant by night when the owner is feeling well, because he's also managing his bipolar condition. When he's feeling well and he buys his fresh ingredients in the palengke and cooks an organic, healthy dinner at night. Daytime, his restaurant, which is called Van Gogh, is bipolar. Yeah. So Quezon City, when you visit, it's so wonderful. You can pick a hat to wear, you sit in your chosen alcove, and Jethro will serve you the dishes with petals and actually edible, and some of them actually taste good. Daytime, Van Gogh is bipolar is a drop-in center for the young people with mental health concerns who forged a community. And what do? They have chosen, and they're supposed to check with their mental health professional, chosen that their path to mental healing and mental health is through their diet. And then they're a support community to each other. They help each other stay in school or go back to school and finish schooling if that's what they want. They help each other get jobs, stay in jobs. They support each other's enterprises. They're a lifeline to each other in some emergency moments and then just in every day. So it was wonderful to hear about elevating indigenous methods of healing. Also the more traditionally known as indigenous methods of healing in the Philippines, which we also, there's an agency, attached agency of the Department of Health called PITAC, Philippine Institute for Traditional and Alternative Health, I forget the C. But, so there is in the government and definitely in civil society also that consciousness and the desire to incorporate it in programs like what should be implemented under the mental health law. This is so beautiful, the elevating the cultural value of kapwa. So as you were saying, culturally rooted, linguistically rooted. Kapwa, we just can't exactly translate it. So it's good when you struggle with a tag, and then with, I heard another word earlier, how you were translating, but kapwa, that's so rich. And if we can translate kapwa into our programs, as you are doing here, and as we are now responsible to do at home, if we can translate that into our programs, then perhaps we can capture in more effective interventions what certain words in English may not be enough to capture. What was it Rodrigo was saying about to help us find the words so we can go home and we can explain ourselves and our experiences to our families. And I'm really hoping that our implementation of the mental health law, like your implementation of your concepts, your programs, your services here, will really give people a handle to express, to be understood, and so to help each other make our lives happier and save our lives. So the campaign about Usaptan, working with the school district, and then you use the term Filipine-X, people of Philippine ancestry. So how important to be able to name ourselves and where we are and when we are. Paulo Freire wrote about that, in Pedagogy of the Oppressed, that it's our power to name that empowers us to have a stake and to commit to change and to imagine and to be bold in affecting these changes individually and then together. Using the social media. So, grabe, thank you so much. Already so much the notes I've taken from all your sharings, and I really look forward to in September and or October or to really explore ways to work together.
Thank you. Some concluding words and then kasi malapit na yung matapos. Pero it's so inspiring that we have on both sides of the Pacific Ocean, right? That we have this common spirit. And it's so inspiring that we left the Philippines and yet we didn't leave the Philippines. Look at this community here. You've all been thinking about Filipino-Americans and the welfare of Filipino-Americans, and that's beautiful to really see. So congratulations, everybody, and let's continue the conversation. I also wanted to say that 4 buildings down the street, tonight, there's going to be an event. And Risa Hontiveros, as you probably know by now, cares a lot about people. And in her role as senator, she fights for integrity in government, transparency in government, accountability in government, responsiveness in government. That's what she stands for. And in a society that's not exactly perfect, there's a lot of corruption, drug addicts are being killed. So it's a tall order for her to be in that kind of an environment. Jay was telling me that her office scrutinizes every law that gets proposed. A lot of the other legislators, they're too busy and they don't really scrutinize. But Risa's office scrutinizes every law. And tonight she's going to speak about what's happening in the Philippines in the area of what we talked about, transparency, integrity, and a government that should be doing good. That's what Risa represents. And she'll talk about the environment that she is in now in the country, doing her magnificent work, but faced with a government that is killing drug addicts, that is jailing its opponents. So tonight she will talk about the struggle for preservation of democracy in our country. We invite you. It's a 10:36 mission at 6 o'clock tonight.
And just to harness all of this connection that we are doing today, I think you brought together Senator Hontiveros, this group of people. We have a critical mass throughout the Bay Area. So let's continue this dialogue. Let's maybe host a Bay Area-wide conference or summit, 2020 or 2021. I think we can do it in 2020. So let us harness all of these resources. Maybe work on some publications so we can share throughout the nation and throughout the global diaspora. We don't have to keep all of this treasure to ourselves. We need to share it and disseminate it. So please, let's continue to share the email contact.
One quick question. Senator Hontiveros is not running again, not for another term.
In 2022, I will.
Oh, you're right. My question would have been, who carries the banner after you're gone?
More people. There's 4 of us in minority now in the Senate, although one, Lila, is in jail still, but she'll be free someday. And then even in the majority, there are some comparatively more independent ones. You could think of Ping Lacson, Grace Poe, Nancy Binay, depending on the bill or the resolution or the proposed department budget up for debate. And well, as you know, as a movement for mental health, other movements for people's well-being and rights tend to grow. No matter the conditions, they can't be contained. So let's keep on searching for and supporting people who we want to represent us here in the Philippines and all other countries. It's a time of great challenge for democracy now. It is due to populism and authoritarianism, but we will come back.
Please sign the mailing list so we can come together again, okay?
I just wanted to say, I know everybody's probably heading out, but Stephanie had mentioned that we're wanting community input regarding this cultural arts and wellness center that we're hoping to push forward. So if people have time, we actually have surveys here, and if you don't, I have flyers with QR codes and a link. We'd love to get your input, especially there's so many wonderful professionals up here. So if you have time, please think of coming to me, I'll come to you. And maybe filling out the survey and not that I have flyers.
Can we also have a group picture?
Yeah. Come forward.
Okay. So, your picture.